Hello, my name is Jim Davis, and over the last several years I've been a heart ambassador here at St. Mary's Medical Center, which is located just outside the city of Philadelphia. But just for the record here, I'm not a doctor. However, I do regularly meet with cardiac patients who are about to undergo invasive heart surgery and/or who have just had open heart surgery. I am a heart patient, and I've been through multiple procedures, including triple bypass surgery, 10 stents in my heart that came from multiple heart catheterizations. I've had a heart attack, and I've had both of my carotid arteries repaired. Most of that so-called on-the-job training, along with a good understanding of cardiac physiology, is how I became and continue to be a very active heart ambassador, meeting with several cardiac patients each and every week. But first, let's do a little disclaimer. Viewing this video presentation and the information provided herein should never be used as a substitute for seeking out and getting sound medical advice, diagnosis, and/or treatment from either your family physician and/or your cardiologist, especially if you're experiencing any form of chest discomfort. Your doctors are the true medical professionals who can assess your individual situation and recommend the proper medical testing and/or intervention. The purpose of this video is to give you a practical sense of what to expect if you are about to have or have just had open heart surgery. These videos are not meant to diagnose, treat, or imply any form of medical advice. And as always, if you are experiencing any form of chest pain, don't wait. Go immediately to the nearest hospital emergency room. Okay, now that we have that out of the way, I'll assume at this point that you've already met with your healthcare professional and you are either scheduled for or are now considering having open heart surgery. In order to make this simple, I've divided this information into several separate sections. The first video contains what you can expect will happen before your bypass surgery. The second video will describe what will be happening during the open heart surgery. The third video explains what to expect when you are waking up from your surgery and what the first few days afterwards will be like. And the fourth video will describe what you can expect your recovery to be like when you go home, along with some helpful hints. So, let's get started. Try not to remember everything I discuss here. If you're like most of the patients that I talk to, you'll remember things as they begin to happen. And you can always go back and listen to the video again. Remember, the purpose of this video is to give you some practical advice, not to answer your medical questions. If I can let you know what and why things are happening around you, then you will be less likely to be nervous, and it will make the whole experience a lot more manageable. And here's another little hint. Share these videos with your family members. Whenever I meet with a patient's family, I always say, the patient may be the one on the operating table, but the truth is, the entire family is having the surgery. Family members can have all of the same fears and concerns that the patient is feeling. And hearing what to expect can help them to feel less nervous as well. Okay, after your surgery has been scheduled, your surgeon's office will most likely arrange an appointment for you with PreAdmission Testing, sometimes called PAT. The PreAdmission Testing office is usually located in the hospital where your surgery will be performed. The medical profession is currently undergoing a considerable number of changes in an attempt to implement better efficiencies and to help lower both patient and hospital expenses. For that reason, not all of your pre-admission testing will be done at the hospital. Information may be gathered from multiple sources, such as your surgeon's office, your cardiologist's office, your primary care physician, and any other member of your personal health care team. This is done in order to lessen the potential for duplicate testing and thereby lessen the potential for duplicate billing. But keep in mind, you are the most important member of your healthcare team. Your help is imperative when compiling all of the information necessary so that it can be reviewed prior to your scheduled day of surgery. One thing you can be sure of is that change will continue to happen. You will be contacted by the PreAdmission Testing office, and you will be scheduled for a telephone interview with a nurse navigator who will evaluate your specific needs for your upcoming surgery. To avoid any delays during your telephone interview, please have the following information available: a list of all your medications and dosages, a list of any over-the-counter medications including vitamins and herbal medications, a list of any allergies you may have, a list of any prior surgical procedures, a list of any recent health issues, a list of any chronic conditions, whether or not you use alcohol, tobacco, and/or any drugs, the name and contact information for whomever may be taking you home, the names and numbers of your primary care physician, cardiologist, and any other specialty doctors. Please let us know if you have any religious, special, or cultural needs. If during your telephone interview it is determined that you may need additional testing or an on-site visit with PAT, you will be scheduled for another appointment. When you come to the hospital for your appointment, please remember to bring with you your insurance card, your driver's license or photo ID, and any copays that may be required. If you're already in the hospital, your pre-admission testing will be kind of done as part of your normal hospital care. So depending on your specific situation, you may not actually do pre-admission testing. If you do, you will be asked to give a complete medical history, and you will be asked to provide a list of the medications you are taking, including any over-the-counter medications and/or supplements. It's a good idea to write down your prescription names and dosages before your appointment, and be sure to bring the list with you. It can sometimes be very difficult to remember all of the medications and dosages, especially if you are taking several different pills. You will get a physical examination and have some routine testing done, such as blood work and a chest x-ray. You can also use this opportunity to ask any questions that you may have about your upcoming surgery, and you should get a brief explanation of what to expect before, during, and after your procedure. Next, you'll be given some written instructions on how to prepare for your day of surgery, including how to prepare yourself the night before and what medications you should take the morning of your surgery. Simply put, you should shower the night before using the soap that you may have been provided. You may also be given some antibacterial, disposable surgical wipes to use on your chest, your arms, and legs after you towel yourself dry. And you should sleep on clean sheets. If you are at home the night before your surgery, you will be given all of the supplies that you need to prepare yourself during your pre-admission testing appointment. Whether you are at home or in the hospital, do not shave the area where your surgery will be with a razor. The nurses will do that for you before surgery. You may also be asked to smear what appears to be a small amount of a Vaseline-type ointment called Bactroban into each of your nostrils with a Q-tip. Once it's in your nostrils, gently press your nostrils together for a few moments. Do not blow your nose after it has been applied. If some trickles down your nose, just pat it dry with a tissue. This is to help ward off MRSA and protect you from colonization of certain bacteria during your surgery. If you're in the hospital, you may have a chest x-ray ordered by your surgeon, and that may be done the night before your surgery. Some surgeons will also order a Doppler ultrasound test to check the movement of blood through your carotid arteries on either side of your neck. It's not a certainty, but some coronary artery disease patients may also have blocked carotid arteries as well. It's just a good time to have them checked. If you are at home the night before your surgery, you will most likely have had these both done during your pre-admission testing a few days before your surgery. On the night before your surgery, you will be asked not to eat or drink anything after midnight. The hospital term for this is NPO, a Latin phrase nil paras. To translate it literally, it means nothing through the mouth. If you are instructed by your surgeon to take specific medication the morning of your surgery, do so only with small sips of water. Be sure to only take the medication your doctor has told you to take before surgery. Do not take any supplements, herbs, vitamins, fish oil, minerals, or blood thinners before your surgery unless your surgeon has said that it's okay to do so. You may also brush your teeth the morning of surgery. All of this is designed to keep your stomach empty before your procedure. You will also be asked to leave your personal items at home, or you can leave them with your family members. You will be asked to remove all jewelry before you go into the operating room. The night before can be very nerve-wracking. In fact, I would be more concerned if one of my patients wasn't a bit upset. Most hospitals have clergy available for you to talk with, psychologists, and heart ambassadors like me to give you an understanding of what you can expect from your surgery. Heart ambassadors are available for you and your family to speak with before your surgery. He or she may come in to speak with you in order to answer any questions and hopefully lessen your anxieties about the surgery. If you're not in the hospital the night before your surgery, you may get a chance to speak with a heart ambassador during your pre-admission testing. Heart ambassadors are usually people who have been through open heart surgery and can answer your questions based on their own personal experience. Don't be bashful. Ask whatever you'd like to know. They, like me, have heard most questions before, more than once, and they are anxious to help. And don't forget that they're available for your family as well. These people are here to help you, and should you feel the need to talk with any one of them, just let your nurse know. Now, try to get a good night's sleep. I know it's easier said than done because your mind will be on your upcoming surgery, but try. If you're in the hospital and overly anxious or just can't sleep, ask your nurse for something to help you relax. Medications are available to help you, but if you don't ask, your nurse won't know. I have mentioned your nurses several times so far. They are an integral part of your care before, during, and after your surgery. You will come to know just how much they actually do for you during your stay in the hospital. Letting them know just how much you value them makes them feel appreciated. Now, let's move on to video number 2, what will be happening during your open heart surgery.